This video is brought to you by Knowledge at W.P. Carey, an online business resource published by the W.P. Carey School of Business at Arizona State University, and the Communications Institute, a nonprofit organization dedicated to the discussion of critical issues in society.
The whole problem with immigration is how to handle the costs that come to local communities. I mean, that's really where immigration hits the ground, as it were, is on local services, schooling, healthcare. I mean, we have a system of laws in this country which says that people shall be protected, and that's people, not necessarily citizens. And so we have a lot of overhead costs associated with the surge of immigration which has occurred in the last 30 years. Congress is ineptly looking at this, but looking at it. I come from Washington. I know a lot of activities at the local level are going forward because Congress has failed to act. I mean, people here in Arizona have had a number of local initiatives. Towns and cities have taken matters into their own hands. But in the end, Congress must pass immigration reform legislation. And they must do so in a way that doesn't bankrupt local communities. I'm confident that Congress will do the following things. First off, they will protect the United States, as they must, from illegal entry. When you have a country with borders, and all countries, by the way, have borders, it is the duty of the government of that country to maintain the borders. And that's something that finally the United States government is starting to do through fences, which I think are sometimes effective, sometimes not, but just through better enforcement, better people on the ground. Secondly, it's very important that the United States have an immigration labor policy that attracts people who have the skills that are in demand. High-skilled people, or people with skills, generally don't burden hospital waiting rooms. They don't cause local health organizations to go into bankruptcy, because they have the money, the means, to buy some of that health care themselves. So if we had a better labor policy, that would certainly help. In the short run, what can we do? Well, a lot of health care comes from the federal government through a matching program with the states. It's the Medicaid program. And if that were better funded and better organized, that would help local communities afford some of this health care. There may be a role for the federal government in addressing the educational spending that local educational districts must do because of a surge of immigration. But in the end, all these little tiny fixes are ineffective, because there must be comprehensive immigration reform from the only government that can do it, and that's the United States government.
Most of the costs are borne by local governments, and there are a few programs now that the federal government has instituted to reimburse counties for detention costs for criminal undocumented immigrants, to reimburse county prosecutors, and also to reimburse hospitals. However, those programs are underfunded, and county detention centers only get about 10% of their actual costs of incarcerating criminal undocumented immigrants.
The impact of immigration on health care has a disparate impact at the local level relative to the state level or the federal level. Most of the things that the federal and state governments pay for don't allow immigrants to take advantage of them. For instance, Medicaid, which is a state federal program that provides health care for low-income individuals. Then in that case, only in an emergency can an undocumented immigrant take advantage of that care, and only if in fact they would have been qualified for that program to begin with by virtue of their income level and the number of people in their family, their level of assets. So this is a very, very small percentage of the undocumented population that's going to have any access to the Medicaid program. Similarly, many of the other kinds of social services that are provided at the state and federal level, undocumented immigrants have no access to. So where you get costs related health care is primarily in the emergency room at the local level with your safety net providers, your public hospitals or your nonprofit hospitals, and then in clinic services provided at the local level. Again, safety net providers who provide care for low-income families.
Immigrants are often seen as driving uncompensated care costs and use of public health insurance, and it's just not the case. While immigrants are more likely to be uninsured, 60% roughly of non-citizens don't have insurance, it's still a small number of people. So there are roughly 3 times as many, even though native-born people are more likely to have insurance, there are still 3 times as many native-born people without health insurance than there are immigrants without health insurance. And immigrants use the healthcare system at significantly lower rates than do native-born people. So even if you assume equal usage, the fact that there are 3 times as many uninsured native-born says that it's really the native-born population that just don't have health insurance that are driving uncompensated care costs. And then when you add to that the fact that immigrants don't use as much health care as native-born, then it becomes really impossible to make the case that immigrants are the reason that we have high uncompensated care costs.
Public policy on immigration is in disarray. Congress failed in its efforts last summer to enact some kind of comprehensive immigration reform, so we're really left to kind of piecemeal approach, and that includes funding the state and local governments for immigration enforcement, some funding to offset costs related to health care and education, but basically absent that comprehensive approach, we're left with a problem that just isn't going to go away until Congress decides to act.